Okay. Good afternoon, Mrs. Salama. I am Dr. Gulab Rai, one of the child doctor working here. How are you doing today?
Thank you, doctor.
Mrs. Salama, I am here to address your concern regarding the ream. Is this the right time to do that?
Yeah, that's fine.
Okay. Mrs. Salama, during our conversation, I will take few notes. Is this okay with you?
Sure, no problem.
Okay. Thank you, Mrs. Salama. Mrs. Salama, can you please explain what brings you here?
Yeah, actually, Reem, she is still not walking very properly, and she started to walk on tiptoes, and she's still tiptoeing. So I'm concerned. What is the issue with her?
Okay. That's Ms. Salama, can you explain since when you have noticed this problem?
Actually, since beginning, she started with the tiptoe walking, and I was told by my local GP that this is normal, and she will be fine after a couple of months. But I feel she's still walking the same way.
Okay, that's really sad to hear that. Mrs. Salama, have your GP performed any tests for his tiptoeing?
No, doctor, nothing. He told me
Doctor,
it is not.
actually, your command is about motor assessment.
Yes, I know, doctor. But I wanted to know if anything had done for his
If
tiptoeing
you
or
will
not.
again ask walking, it seems like you are taking history on it.
No, no, I'm not taking it. I just wanted to know is anything done for that or not.
Okay. Okay.
Okay.
You can ask about
Your
the
GP
investigation,
performed
yeah,
any
but
test?
don't mention walk. Generally ask about anything being investigated for anything. Don't mention walk only.
Okay. Okay, Mrs. Salama, is there any investigation done for that?
No, nothing.
Okay. Mrs. Salama, can you tell me regarding Reem's speech? Is this fine?
Uh, yeah, she is a talkative girl. She is always, telling stories.
That's really good. Mrs. Salama, can you tell me, is she no counting?
Yes, she knows. She can count, I think, up to 10 or 12, I think.
That's great. And what about her toilet training?
Yeah, she is going to the washroom alone now.
Mm-hmm. Oh, that's good. Is she dry by night?
No, she's still not dry by night.
Okay. She's dry by day.
Yeah, she's without diapers in the day. She can tell her toilet needs.
Okay, that's good. Uh, can she make friends and enjoying with her peers?
Sorry again, doctor?
Is she enjoying with her peers, playing with her age group
Yeah,
kids?
she likes to play with them. She loves company.
That's good. Mrs. Sama, can you tell me, have you ever noticed any strange thing regarding her appearance, or someone of your GP told you regarding this?
What do you mean, Doctor Strange?
A strange appearance, like her facies?
No, doctor, no.
No. Have you ever concerned regarding her hearing and vision?
No, doctor. She's fine with that.
Okay, that's good. Have you ever noticed something about her head size?
But no, doctor, I think it is fine.
That's good. What about, is she ever suffer any trauma, physical trauma or emotional trauma?
Physical trauma in the sense where?
Any accident?
No.
That's good. What about her skin? Is there any lump, bump, or rash on her skin?
No, doctor. Nothing that I noticed unusual.
Have you ever noticed her heart is raising or she's feeling a bit difficulty in her breathing?
No, doctor.
What's about her pee and poo?
That is fine, doctor.
Is there anything, something you want to mention regarding her joints?
No, I think she's fine. She appears okay to me.
Okay, that's good. Was she ever admitted before due to any reason, any medical or surgical reasons?
No, doctor.
That's good. Can you describe her birth for me?
Yeah, she was born at, I think I was almost nearly term, and a cesarean.
Sorry, doctor.
It
Sorry,
it was,
Mrs. Salama.
yeah,
Your voice is a bit distorted.
yeah, they did a cesarean section for me, and
Mm-hmm.
yeah, that's what I remember.
Why they did cesarean section?
Because she was, her presentation was not her head, was presenting from her back. That's why they told it would be difficult to now extract her through a normal delivery.
Okay. Was there any complications she suffered after birth?
Nothing. She was absolutely fine, and nothing was wrong with her.
That's good to hear. Mrs. Salama, was all the screenings were done at that time of birth?
What scanning, doctor?
Birth screening after the birth, every hospital has a protocol to do some test from the heel prick.
A screening, yeah. Her screening tests were done, and they were fine.
That's good. Mrs. Salama, was there any officially they have checked her hearing and vision?
Yeah, her hearing was checked, but not the vision, doctor.
Okay, was that normal at that time?
Yeah, normal.
Okay. Can you please explain your family for me?
Yeah, she's my only child, and yeah, me and my partner, we are living together.
Hmm. Okay. Is your marriage is consanguineous within the family or outside that?
Yeah, it is within the family.
Good. Did she receive all her jabs?
Yeah, she did.
Is she received any extra jabs?
No, doctor. Just the routine.
Okay, that's good. Can you describe anything you suffered? Is there any difficulty you are facing to managing Reem at home?
Not really, doctor. She is able to, run, do other things, but just that I'm concerned about her posture. I don't know. Maybe she will continue to be like this, or she will become better.
You have 2 minutes, doctor.
Okay. Oh, don't worry, Mrs. Reem. She will be all right. How's Reem's school? Is she going to any school?
Yeah, she is attending a nursery now.
Okay, she's attending. Is she enjoying there?
Yeah, she loves going there.
That's good. Mrs. Reem, who is the earning hand of your family? Mrs. Salama?
Actually, both of us are earning. Me and my husband. Us.
Okay, then who's taking care of Reem in your absence?
Generally, I'll send her to the nursery, and then after that, she will attend some daycare till I return back home.
Okay. Thank you for your time, Mrs. Salama. I will get back to you after discussing with my consultants. If you want to mention something, I am going to summarize our conversation today. That Reem is 4 years old, and you have concern regarding her difficulty in walking. While she is good at school, she can tell you stories, and she is dry by day but not by night. She was born via C-section because of her presentation. Is there anything you want to mention in this?
No, doctor, just that.
Okay, thank you, Mrs. Salama. I will get back to you after discussing with my consultant.
Thank you, doctor.
Thank you.
Okay, present your case.
Reem is a 4 years old girl. Her mother concerns is she has a difficulty in walking, while her motor and social speech seems appropriate for her age because she can tell stories. She knows her name. She is toilet trained. She's going to toilet.
Have 2 lines only, 2 lines, okay? Two
Okay.
lines.
Okay, I will try again. Reem is a 4 years old girl. Her mother is concerned regarding her walking difficulty. While she is appropriate for her social and speech milestones, she was born by a C-section due to breech presentation.
Okay, good, okay. Okay,
You
so
didn't tell important negatives also. You didn't find anything significant in the birth and past history apart from it.
I have just found that she was breech presentation, and that's why
Yeah, that
she
is a
was
positive, right? And the rest of the history, you didn't find anything.
no. Rest of the history was negative.
okay.
What is your differential then?
My differential is that she has a isolated motor milestone delay.
So what you kept in
Maybe secondary
differential,
due to
because the same question you would have asked in the systemic review, na? What about your differentials?
my differential might be developmental dysplasia of hip, Yiddish, and muscular dystrophies like Becker's
Okay.
or Duchenne or spinomuscular atrophies.
Okay.
Did you ask about the similar illness in the family because you were suspecting all these disorders?
Actually, she was a single child and marriage was not consanguineous. So I didn't ask that.
But you should ask, na? Maybe in a nephew, in a niece, maybe mother herself is having some concerns.
Okay.
Because you kept DDH also, na? So that's what is like, even consanguinity, it can happen without that.
Yes. Okay.
Okay. So the history was good, Dr. Gulab, and you reached to the diagnosis also. But some important, as Dr. Shumala mentioned, were a bit, missing. So always, look at differentials and you can, ask the relevant questions accordingly.
Okay.
I think just you should polish a bit of your questions more when you are taking the developmental history. For example, you asked about the hand use, so simply ask how she using her hands, how is she with colors. Okay, don't give long statements. Okay, because
Okay.
that's your time also. And similarly, so that is enough. Okay. Okay, so
Okay.
don't put your questions in 2-3 ways because this takes away your time. Okay. And as you mentioned, station is a long station when has time. So you have to be quick. And then again, in the past history, I think again there was a very you did not ask about the mother to describe her pregnancy. You directly came to the birth history. Can you describe her birth? Before birth, first ask how was can you
What was
describe
the
your
point
pregnancy?
you could have asked if you kept DDH in the antenatal history?
The child's movement in tummy
Yeah.
and jelly scans.
Yes. So you could have found out maybe that was showing some oligohydramnios or something in the scans. Okay. Yeah. So that's why antenatal was also important. Just
Okay.
you have to go through your differentials and ask questions.
Ma'am,
When
here
she
as the
mother told me that baby was breech presentation, that's why cesarean was done.
Mm.
Is was necessary to ask jelly scans?
No, just can you anything significant during pregnancy? So she would herself mentioned.
you start with the pregnancy first, okay? Don't go directly to the birth, okay? So, mom, can you describe
Okay.
pregnancy to me and significant?
If you will ask na describe pregnancy, so the role player will tell you, yeah, there were some scans. Sometimes they showed it was less fluid, was less, and maybe that if it. But you would have asked that question. If you would not ask that question, she will not tell you about the pregnancy details. And maybe this case was relevant, so maybe she had the clue of oligohydramnios because this was a case of if it was a DDH, and that was right. Your first diagnosis was DDH.
Okay.
And keep in mind, maybe the examiner will ask you later also. So if you think this is your differential, what questions you would like to ask the mother about? What further questions you would ask in the history? Like
Further question regarding pregnancy.
regarding DDH, what further question you will dig out in the history from the mother?
Okay. Family history of same illness
Good,
and oligohydramnios.
good,
She already told me that she's
good.
breech presentation.
Very
She's
good.
a female. That's also a point.
Yes. Firstborn.
Um,
She was the
yes,
firstborn, right?
firstborn.
Oh,
Yes, that's
And in this history, the key, the mother had hip pain
hip problem.
and hip problem that was not worked up. So it is something that is running in her family. And then also, Dr. Gulab, when she clearly told you it was a breech presentation, you should ask
Mm,
when investigations were done because she was born this way. The workup was done. So she might tell, no, I did not go for follow-up. They advised me, but I did not think it was necessary. Or maybe, she has some other answers. It was advised to her. Okay.
okay.
So
actually,
these
in some countries, actually, if it's a breach, they are following it with a hip scan in some countries. So
Yeah.
that's why. And sometimes it's like that, like mother is not taking it seriously. She didn't come up, or maybe it was missed by some of the doctors also, like that she was at risk of DDH to book her for scans. Okay, so that's why the investigation part was any is important. You do ask about it before important investigation was done, but do ask in the birth history also.
Okay.
Okay, so we will go for the developmental assessment now.
One thing more, I just want to tell you, like when you are taking the systemic review, like for everyone, do keep the CNS symptoms and this increase and decrease in head size, abnormal movements, because mostly are developmental delayed. So you have to check it, like how you will check the, how is the child, is the CP or something else. So do keep these questions on the top of the list before going to GI and CVS. Before going to GI, cardiovascular, do keep the CNS questions and the questions that are important for the development view. I don't remember whether did you ask increase or decrease in head size. Okay, so that are the typical questions you have to looks similar to the family or these things. Unless and until you got a clue, like when you are asking and you got a clue of calf muscle hypertrophy, okay, fine, your diagnosis will go somewhere around.
Okay. And doctor, can you tell me how we will ask regarding dysmorphism in history?
Does he look similar to you or your husband?
Actually, someone of my friend told me that he asked that question in exam. So
Okay.
examiner got offended. He said, "Are you doubting mother's character? That's why you are asking
How
that."
he asked, what was the question he put
He
forward?
asked, "Is your child look like your husband or you?" So examiner got, "Are you doubting her mother's character?" That's why you're asking that?
No, I think it is not a good thing because the syndromic you cannot ask directly whether his facies.
So,
You can
so
simply
someone
does
told
he
me
facies?
that ask indirectly way and ask, have you noticed any strange thing regarding the appearance of the child?
No, no,
That mother might.
this is also offending. Strange thing, no. So you can simply ask, does he, have you noticed anything different in his face as compared to other children? Just that, okay? So you put it that way. If that is the issue with some examiner, don't put it then that way.
Yes, that's why I have changed that. Mother
No,
will
it's
comment
good because
regarding the appearance of
different
child.
centers, the examiners gets little bit offended. So it's good like if you pick up something, so you can rephrase it like as Dr. Madhya said, does you think his appearance looks different? That's it. Whether it looks different from the children or looks different from the parents, and I don't think so that would be much.
Okay.
Does his appearance looks different to you?
Okay.
And doctor, one
Okay,
more
so
thing, that was okay for this history, but the first word and the first social smile, the previous, you didn't ask the milestones when you asked for the milestones. You asked for the current, that's good. But when was the first milestone that was missing?
Okay.
Okay.
I forgot that.
Yeah, you take a quick history because you were very much into time. That's why maybe one to two things were missing, but your time was good. And you get to the diagnosis, just minor things were there so that you can keep on the format next time.
Okay, doctor.
yeah, so one question of the current and one of the first milestone.
Okay.
So
We
now the
can,
assessment you can start.
so your command
Okay.
motor, Shumaila, gross motor,
Yes,
right?
all motor,
All,
because you didn't ask anything for fine motor. You have to do complete gross motor and fine motor assessment.
okay.
Okay. Mm. Hello, Mrs. Salama. I want to play with Reem to assist what's the difficulty with her walking. Am I allowed to do that?
Yeah, sure, doctor.
Okay. Hello, Reem. How are you? Can you shake a hand?
Yes.
Okay. How's she looking? Is there any dysmorphism?
No.
Is she appropriate for her age?
Yeah, she looks.
Look appropriate for her age. Is there any devices attached? Any
No.
orthoses, sticks,
No.
spectacles?
No.
No. Okay. Hello, Reem. What are you doing, Reem?
I'm playing with the blocks.
Oh, that's good. Let's play together. I'm also good play one. Love to play with blocks. Look, I'm making a tower. Let's have a game.
Okay.
Let's see who will make a bigger tower. Okay?
Oh,
Okay. Let's start.
okay.
How many blocks she's using?
He makes a tower of 13 blocks.
13 blocks. Okay, that's good, Reem. Reem, look what I'm doing with blocks. I'm making a train. Can you make this?
That is easy. Here you are.
Okay. Show me.
Yes. Done.
Done. That's good. How many blocks she used to make a train?
I used 3 blocks.
That's good. Reem, look, I have a crayon and a book. Can you do you love painting?
Yes.
Okay, me too. Let's make something. Take it. I am giving crayon in her right hand. Is she how she's holding it?
She's holding in her left hand.
She's holding her left hand. I am giving another crayon to his right hand, her right hand as well. Is she holding it?
Yeah, she's holding in both.
Both hand. And how's the grip?
Grip seems to be nice. She's holding very well.
A delicate pencil grip or tripod grip?
It's a delicate pencil.
Oh, that's good. Reem, look, I'm making a square. Can you make this?
That is easy.
Show me.
Okay, done.
That's great. Reem, look, I'm going to make Mama's picture. Can you do that? Look, her head, body, legs. Can you do that?
Yeah, she makes with 3 parts only.
3 parts only. That's good. Very good girl, Reem. Reem, look, which color is it? Look at this. What's the color it is?
Red.
Red. Okay, I am fitting this end here in this board. Can you do that?
Yeah, she does it.
Okay. Look, which that's called pentagon. Can you fix it in this board?
Pentagon, she is trying, but she cannot put.
Oh, guys, that's a good try, Reem. Don't worry. Let's play something else. Look, I have a scissor. Let's cut the paper. Okay? Come on, let's go. I'm cutting it through and through. Can you do that?
Yeah, she can do it.
Okay, Reem, look, I'm cutting in a square shape. Can you do that?
No, she cannot.
Okay, that's fine. Don't worry. Reem, come on, let's go. There's a ball. Let's play with that ball. Come with me. Is she coming with me?
Yeah, she's coming with you.
How's her gait?
She's tiptoeing.
Tiptoeing. Let's run, Reem.
She's running, but with a tiptoe.
Oh, that's good, Reem. Come on, let's play with ball. Catch. Catch it.
She cannot catch.
Oh, that's fine. Come on, let's go and kick that ball. Run.
It's difficult for her to kick and run.
Okay,
Kick.
that's it. I'm placing the ball here. Okay, now stand and can you kick it?
Yeah, she can.
Oh, that's good, Reem. Reem, can you ride that tricycle?
Yeah, she can. She's riding it.
Very good, Reem. Come on, let's go. Go upstairs. I think there's something upstairs there. Come on, let's go and have a check.
Okay, let's go.
How she's climbing?
She's going in a child manner.
In child manner. Okay, and how's she coming down?
Also in a child manner.
Okay. Thank you, Reem. Thank you for your time. Now you can play with the hair with your blocks. I will come back to you in a while. Okay, Reem?
Okay, thank you, doctor.
Thank you.
Okay, so present it now, your findings.
Reem is a very cooperative girl. She can make a tower of 13 blocks with drain of 3 blocks. She can draw a main with 3 parts. She can climb upstairs and downstairs with child manner.
Finish fine motor first. Finish the fine motor area first. Give her fine motor. Go to gross motor.
Reem is a lovely cooperative girl. She can make a block tower of 13 blocks.
Today she demonstrated.
Today she demonstrated the making of making a tower of 13 blocks. She can also make a train of 3 blocks. She can cut paper through entire the paper, but not in she can cut papers straight.
Good.
And she can fit the basic shapes in the board. she can also run in tiptoe manner, but not in
What
straight.
about the
She
crayons?
can,
You didn't finish the fine motor, doctor. She was doing something with
uh,
the crayons, na?
yes,
You checked
she
it.
can make a square shape.
Yeah.
Okay.
Mm.
o- Okay.
She can make a square shape. Her fine motors are
So what
appropriate
she did
for
not
her age.
Hmm?
what she did
While
today. However, she did not demonstrate what.
However, she did not demonstrate that she can fit uh, difficult
Complex in the board.
complex shapes in the board. She didn't. She did not also demonstrate that she can cut the paper in shape. And she, yes, these two things in fine
About the
motor she didn't demonstrate it.
okay. So her fine motor age is what?
4 years.
4 years. Okay. And then
While in a gross motor area, she demonstrated she can run on tiptoe. She can kick the ball while standing. She can climb stairs with child manner and also downstairs with child manner. While she did not demonstrate that she can catch the ball or kick the ball while running, and she also did not demonstrate that she can climb stairs in adult manner. So
excellent.
her gross motor age is up to 3 years. Up to,
Why
sorry,
3
two
years?
years.
Yeah,
Two
three,
years.
2 years. Good.
Two
So
years.
because upstairs, downstairs, both child manner she came.
Child
Okay.
manner and but what about tiptoe running?
Tiptoe running will be normal for her, na? She is tiptoed. So she will be able to do tiptoe running
Her walk is
because
normal, na?
Tiptoe running is the milestone of 3 years.
no, but that's what I'm telling you. She's walking tiptoe. It means she is tiptoed. So of course, when she will run tiptoed. So she's not. It is not a milestone. It is a problem that is making her run in
That's
that
why
way.
we wanted to add this, na? Because tiptoe you guys are checking. So tiptoe is because of disease also. It's like
Yes,
if
yes.
you are checking tiptoe, then it's a confusion. So you have to come up to it whether it's a disease or child milestone is going tiptoe. In this case, it was a disease, right?
Right.
But actually, Dr. Gulab, you did very well. Majority of the thing, gross motor was excellent. Just as I told you the format of that, you asked them to make a tower of 30, make a tower and see how much she's making. Then she told you she's making a tower of 13. You didn't
Mm.
encourage her to do more. Okay, let's try. Can you do it a little bit more? Okay. And then when she's making 13, then instead of going up to stairs, right? Between 4 and 5, the differentiating is stairs. You would have asked, okay, can you make the stairs? Because if you go back to the train and bridge, that will come at 3 years. Okay. So when she's showing some signs of 4 years, like she was able to make a tower of 13, you have to go up further, try to go up. But even if she's not doing that, you have to ask one question forward to her age to just check it whether it was the right thing she was doing or she is going up beyond that also with some encouragement, because you have to encourage the child, always encourage. Okay, let's try more. Are you able? Okay, no problem. It's good. The only thing is that similar way, when you were asked them to draw certain shapes, you asked them, okay, are you able to draw a square? Yes, yes, she can do that. But you didn't go
But
beyond
I didn't
triangle.
take the beyond it.
You didn't take
Okay.
it beyond to
I should
triangle.
ask her to make triangle.
Exactly, exactly. Then you ask for
That,
the body parts. She's identifying, okay, how much you are doing it more. So just encourage them to do more of that.
yes, that is the way.
Okay.
That is
He
was
did
the
good.
exciting thing
Yeah.
actually. Because you
You
have to check.
asked the way in scissor, you asked to whether she's able to cut through, okay, and then cut shapes. No, okay, so cut through is the age. That way you asked in scissor, but before that, it was the one that you didn't ask. The other thing is beads. You didn't ask about the beads, so you forgot, I think, to check the beads.
Yes, I
So
forgot
take
to
that
check beats.
mnemonic 2CS and then cubes, crayons, scissor, beads, book, board. Okay, so 3B, 2C and S. So remember this mnemonic, 2CS and then 3B. But it was
Okay.
very good. Excellent. It's much improved from yesterday.
Excellent. And the way you approach the child and you encourage and you made
Very
it a
good.
play, that was very good. So this carries a lot of,
Interactive way, yes.
yeah.
And your
So
history
just,
was
Thank
also
you,
very
doctor.
good today, and you came up to a diagnosis. It's excellent.
so just that this is a very important point that Dr. Shumaila has emphasized. If a child is doing something appropriate, don't stop there. Encourage, do more. So you can maybe she was doing the triangle also, but you did not ask. Okay, so maybe her age in the examiner's sheet is 5 years, but because you did not go there, you didn't know. Okay, so make sure that you don't miss that part. Okay.
And don't go down. If she is achieving 4-year milestone, don't touch on the things she is going down. Bridge and train, usually it's 3 years. So just try one milestone, you got it. Try to move forward, encourage more, appreciate more, or either stop, because if she's not doing more, then you have to stop at the same. So I think
So
it is very well done by all of you, and I hope you will understanding the format very well now.